Welcome, everybody. This panel is focused on health, aging, and climate change. I'm Dr. Kyle Martin. I am Assistant Professor of Emergency Medicine and the co-director of the Planetary Health Initiative in the Division of Biology and Medicine here at Brown University. As I mentioned in this panel, I'm going to ask the members of the panel 3 rounds worth of questions, and then after that, we'll have an opportunity for the audience, including those members on Zoom, to ask questions to the panelists. Before moving on to the questions, I want to briefly just highlight again our community partners who are in the audience. If the team from the Providence Emergency Management Agency wouldn't mind standing up one more time. I know we highlighted you before, or just give like a gentle wave. Again, we really appreciate the community partners that are here today. One of the big focuses of this event is to highlight community engagement and our connections between our campus, our on-campus faculty and the community members that we work alongside. So without any further ado, I want to move on to the introductions for each of our panelists. And we're going to start with Emily. Emily, if you wouldn't mind just talking a bit about yourself and the work that you do.
Sure. Hey there. So it sounds like this is on. Yeah. Okay. Hi. So my name is Emily Gadbois, and I'm an associate professor of health services policy and practice, and I'm based in the Center for Gerontology and Healthcare Research in the School of Public Health. And I am the Community Engagement Core lead for our Chair C grant, which stands for the Center on Heat, Health, and Aging Innovation and Research Solutions for Communities, Chair C. This is a P20 grant that was funded by the National Institute on Aging, and it's sort of a development grant. It's a 3-year grant. We just started the 2nd year of it, and the whole goal is to foster and promote and advance community-engaged science related to healthy aging and climate change. We've got 4 cores of this research grant, so I lead the community engagement core. Beth Fussell leads the capacity building core. Allan, just to my left, leads the research project, and Teresa Shireman, who's unable to be here today, leads the administrative core. And so these 4 interconnected, interdisciplinary cores are all united on this common goal of trying to promote healthy aging in the face of climate change. And so our community engagement core has 3 aims, the first of which is all about collaboration. So it's about facilitating engagement with community partners on issues related to extreme weather, climate, and healthy aging. And so our main goal under this aim is to connect with the people that are already doing work in these spaces. So in Rhode Island, there are a wealth of community-based organizations that provide services to older adults and or are focused on environmental health and environmental justice. And so the first year of the grant, we really spent connecting with people who are already doing wonderful work in this space, trying to get a lay of the land, trying to understand what their priorities were and their needs were as it related to climate change and healthy aging. We had some challenges in that it's a tough time to be a community-based organization doing work on climate change and work on older adult health. And while the issues of older adult health and climate change were part of the mission of most of these organizations, they often weren't like the primary goal of the organization. You can see it's a little bit small here, but we've got a number of partners, and these are both organizations that provide services to older adults, like PACE of Rhode Island and Meals on Wheels of Rhode Island, and then others that are focused on environmental health. And so, while Meals on Wheels, for example, climate is central to many of their activities, it's not their primary objective. So trying to figure out how do we thread that needle of meeting people's goals and helping them to do work that aligns with their needs. So aim 1 was about the connections. Aim 2 is substantive work that we're really getting started on now that the relationships are more solidified. And then aim 3 is about evaluating our efforts and ensuring that we're advancing in our engagement and that we're not wasting community partners' time, making sure that we're really being a value added and learning from our own mistakes. And with that, I'll pass it back. Thank you.
Thanks so much, Emily. I really appreciate it. Now we're going to move on to Allan. Allan, if you wouldn't mind talking about your work as well.
All right, thank you so much. I'm Allan Just. I'm an environmental epidemiologist, and I'm in the Department of Epidemiology and the Institute at Brown for Environment and Society. And a lot of my work focuses on trying to create better reconstructions of heat, temperature, humidity, solar radiation, and also fine particulate air pollution, small particles that can get deep into the lungs and impact human health. And taking these reconstructions, linking them to health registries, demographic data, and existing cohort studies to better understand the relationships between exposure and human health. I think a lot of us have conceptualized, so much of my work is on heat or air pollution, and these days people pull out their phone and they see, a temperature on their phone, and we don't really necessarily internalize that the temperature can vary quite a bit from place to place, and that a lot of research has been done historically with meteorologic stations that are at the airport. Most of us are not living at the airport. I try to spend as little time at the airport as possible. And so part of my research is better understanding the implications of this. So we're building models, national models. I have work in the United States and in Mexico as well. And then when we link it into the registry, into large registries, and those could be registries of, it could be, some of my work is about birth outcomes, and in Chairs C, my work is on older populations. The story is always essentially that we've underestimated the disparities in who is exposed to extreme heat or air pollution. This is not, it's not randomly distributed, right? There's real patterns of residential segregation and land cover, land use decision-making that has led to, gradients of exposure that we tend to underestimate when we use either coarser resolution exposures or sort of just borrowing information from the closest airport. And so the story is that we've underestimated the disparities in exposure, and we've also underestimated how bad these things are because we've kind of attenuated these associations by muddling them up with not amazing exposure reconstructions. And so we're able to link these together and get a better estimate of what people are exposed to and that exposure-response relationship. And we think that this has real implications at the societal level because we've been underestimating how bad heat and air pollution are for human health, right? We've been sort of getting that tally wrong. And then also that's hurt our ability to understand which groups are particularly vulnerable. And they could be vulnerable because they have higher exposure because of land cover and land use and residential segregation. It could be that they're more vulnerable because of susceptibilities related to preconditions. It could be other social determinants of health that lead to that susceptibility. Or it could be that they have diminished adaptive capacity. We're sitting in a part of the country with a really old building stock, and the buildings that we live in, that we send our kids to school in, where we give people medical care, they weren't constructed for the climate that is coming. And so those dimensions of vulnerability, I think, are better understood when we're able to bring to bear better exposure information about what people have been experiencing, where they live, and where they're breathing. So right now, as part of Chair C, we're linking in these national models. We cover the contiguous US, so we've got the 48 states and Washington, D.C., and we're linking it into records from all of Medicare. So we're able to really leverage the size of that data to let us disentangle how these relationships vary when we look at medical preconditions or think about how, one of the pieces of it is to think about how common medications that are used to treat chronic conditions can leave people more susceptible to the health impacts of extreme heat, to think about whether we need to be building a basis to reconsider some of the clinical decisions that are made in an aging population where we will be seeing more and more extreme heat.
Thanks, Allan. That was great. A lot there, which is perfect for when we break into our discussion section. But for now, I'm going to move on to Kate. Kate, if you would like to talk about the work that you've been doing in Rhode Island with emergency medicine systems.
So I'm Kate Moretti. I'm an emergency physician, and I am going to talk specifically about a project we're doing looking at, or just finishing up actually, looking at urban heat islands and EMS utilization. And I think we've heard this echoed a couple of times, but I think that we're underestimating heat impacts. So we as emergency physicians or physicians at large, when we think about the impact of heat on health, or you ask medical students, the first thing they'll say is heat stroke and heat exhaustion. And we heard that from Slim, right? And it is a huge impact, but it's only one impact. And what we see is that there's actually impacts across a variety of different body systems and pathologies. So yes, you can get heat exhaustion and heat stroke, but you can also have a heart attack. You can also have a stroke. Your kidneys can fail. Your sodium levels can shift. And when patients come in and their body temperature isn't 104, but they're suffering one of these other impacts, we don't count them. They often don't get counted in the impacts that heat has. And therefore, I think it's underestimated how much we're being impacted by heat. We as physicians are underestimating it. I think our decision makers are underestimating it. And I think the general population is underestimating it. So I think when somebody comes in with that heart attack, they don't tie their heart attack to the heat exposure that they've had. There's also the complications that there is potentially a lag. So you might be exposed to a high temperature or a couple of days of a high temperature, but your health impact doesn't come. You don't see me for another 2 or 3 days. And so this really complicates how we're quantifying this. And this is something we've been kind of grappling with. So this project, what it did was it looked at EMS encounters as a marker of morbidity. And it was an EMS encounter for anything. And it looked at how EMS encounters change if you are coming from a heat island in Rhode Island or not. And we quantified that change as summer temperatures went up. And what we could see just generally, and we looked at all sorts of different, ways of looking at this, but there's a 30% increase in urban heat islands compared to not as the temperature rises. So EMS will go up 30% more than compared to non-heat islands. And this is even more pronounced if you look at the elderly population, so those 65 and up. I'm not saying if you're 67, you're elderly, but that's how we defined it here. So we could see that impact even more greatly there. And the hope is that because this is Rhode Island specific, that we can take these numbers and we can start a conversation with decision makers. So this gives us one area you could focus on for mitigation at a community level, but then it also looked at demographics, right? Age and gender, et cetera, that allows you to then start to imagine what interventions might look at on an individual basis. Who do we want to find? Who do we care about that's really being impacted by heat? How do we identify those people? And then what do we do on a community level? Do we increase EMS responses or resources in these urban heat islands? Do we talk to our parks departments about where they're putting misters or cool islands, right? Are they putting them in the right places? And this was kind of the first step in starting those conversations. I'll stop there.
Thanks, Kate. And then moving on to our last panelist, Corey, if you wouldn't mind talking about the work that you're doing related to coal power plants.
Sure. Yeah. Hi, everybody. I'm Corey Ziegler. I'm a professor of biostatistics at the School of Public Health here. So I do mostly statistical methods development in environmental health and the environmental sciences, It's been mostly in the context of air pollution and air pollution regulatory policy, but some other climate-related exposures also. I highlighted here some work that I've done on coal-fired power plants in the U.S., which you can sort of see some of the headline results there. Don't worry about the figure for the time being. But the idea is coal power plants are a major source of air pollution in the United States, and we did some work to quantify the health benefits, a health burden among Medicare beneficiaries in the U.S. That was specific to the pollution that comes from a coal-fired power plant. And there were a couple of things I wanted to highlight about sort of why I chose to put this up on this slide. One has to do with kind of policy relevance in the context of environmental exposure. So there's a whole set of questions about what pollution is in the air and how it makes us sick. And those are important questions. But it's a separate set of questions of what can we actually do to make the air pollution better? That's like a regulatory question. And in order to answer questions like that, we need to know something about the sources that the pollution came from, because that's ultimately where we can regulate. So there are lots of regulations to limit emissions from coal-fired power plants in the U.S., for example. And it was this sort of focus on not just all particulate air pollution, but the pollution that was specifically generated by coal combustion at power plants. It was that focused on sources that led us to some other insights. So, for example, I have up there that it turns out that the particulate pollution that comes from a coal-fired power plant, we had evidence that it was about twice as harmful as the other types of particulate pollution that are out there, for example. So that might be important to know if we want to think about regulating particulate pollution in the U.S. But there's another thing I wanted to highlight about this work, and this is really the only reason I put that figure up there, even though I know you can't read it. But you see that figure is a bunch of horizontal lines, right, of different widths. And each of those lines is tabulating a number of excess deaths attributable to a single coal power plant in the U.S. And so that was important. And one of the reasons that's important is that it does lead to some of the types of community engagement that we were talking about, especially this morning, because there are communities who know there's a power plant nearby, and they say, well, in fact, this is going on right now. And outside Omaha, the power plant says, well, we were going to close our 2 coal units down, but now it looks like maybe we're not going to because there's a lot of data centers going up. The federal government is not really enforcing things the way that we thought they were going to, et cetera, et cetera. And the surrounding community is really concerned about that. So you can sort of picture that happening over and over again. And the tools that were available before we got into this work, they were not really good at attributing sort of exposure and health effects to individual large point sources of air pollution like this, when the air pollution really blows all over the atmosphere, and it's sort of a complicated problem. So this sort of figure was just meant to remind me really to highlight that a big feature of this work was trying to trace impacts associated with individual large point sources of air pollution versus just asking questions about the air pollution, which could come from really anywhere. And I think the last thing I wanted to say about this, which I guess I just sort of alluded to, I mean, so these results are from a paper that came out a couple years ago, and we kind of thought we were done asking questions about coal power plants, at least in the US. Globally, it's a much bigger problem. But for the things I just alluded to a moment ago, now it's not clear. There have been a lot of sort of plans to retire coal power plants that companies are now maybe not doing it. I don't know of any plans to build more new coal power plants in the U.S. But I think that a lot of expectations of phasing out coal power in the United States are being kind of revisited in the current climate, and that's a demand thing and that's a regulatory thing. So some of these things are becoming more relevant, re-emerging in relevance compared to where we thought they were when we finished this work a couple years ago. Yeah, that's all I'll say.
Great. Well, thank you, everybody, for talking a bit about your individual work. And now we'll transition into these great questions that I've written for all of you. We're going to start with you, Emily. Emily, a lot of your work is with Chair C, focused on community engagement. And I just wanted you to talk about, what some of the potential benefits of community engagement are for academic faculty or researchers here at Brown.
Sure. So happy to speak a little bit more to that. So I come at this. I'm new. I think this is a question you'll ask later, but newer to climate change research. I'm a gerontologist and health services researcher, and much of my research has been qualitative, and so involves learning directly from people for whom the work is relevant in many cases. And it always sort of, it felt like a natural extension to then branch out into being more explicitly focused on community engagement research. The benefits that we've seen so far on this project are pretty substantial in that, like, we want our research to directly benefit the people for whom we think that it's all about. So often, we'll create a research question that we think is super important. It's informed by the literature. It's a burning question for all of us. It's well-intentioned, but will doing it actually result in any improvements in well-being and improvements in outcomes for the people that we care about? And so by engaging directly with community partners, communities for whom the research we hope is relevant, we can better develop our questions from the start. We also can make sure that we're thinking about sorry, I'm a little jet lagged, so a little bit fuzzy. Logistically, it also makes it easier to carry out the research. We are Sorry, can we come back to me?
You're okay. Yeah, no problem. I mean, Allan, I'll jump to you. It kind of builds off of this question. I wondered if you might be able to just speak a little bit about some of the community partnerships that you've had with some of your research. I know that you've done some work with schools and playgrounds in the area, looking specifically at tree cover and heat exposure and particulate air matter. You can speak to that or some of the other partnerships that you've had if you'd like.
Yeah, thanks so much. So one of the features of my work has been that I'm mostly focused on the past, and reconstructing anything is hard, but the past is definitely easier than the future. But it makes, it limits some of the actionability. And so with modeling schoolyard shade, the availability of shady places for children to play, and thinking about tree canopy availability and tree equity, that can inform landscape level tree plantings. And so that's something that the Providence Neighborhood Planting Program is undertaking. And I think that kind of information can be actionable for that sort of longer term planning and change, thinking about our land use, land cover decisions at a neighborhood level, or even as locally as within a schoolyard. Is there a place where people will have some respite from the sun? But when I think about the broader themes of my research of building all of this reconstruction, I also think that there's this hope that we can impact that one of the communities that we engage with are regulators, and they could be, regulators at different levels. But I have some work now in central Mexico where we're using some of our satellite-based models, because they're undertaking the kinds of regional air quality planning that, when informed by health, can really bend the curve in the ways that the Clean Air Act historically has been really successful. So I think moving forward, I would love to think about ways that lessons that we've learned from the near past are more applicable to the future, because I think that many of our partners are really seeking things that are actionable on shorter term timescales. But I would say that people really love high resolution reconstructions of where the trees are, because that is definitely a way to partner with people on a very tangible way in which they view their environment.
Yeah, I think what I've heard from both of you so far is working with community partners can help to identify projects and then identify tangible results or tangible sorts of objectives and goals to achieve. Kate, talking about your research with emergency medical services, I mean, you identified vulnerable populations. Can you speak a little bit more as to how your findings might affect vulnerable populations or might benefit vulnerable populations via changes to policy or in partnership with the Providence Emergency Medical Management Association?
Yeah, so all of this project and work that I've done with this has been informed by working with Pima, and I'll just call her out by name, by Clara, who has been unbelievable to work with. It's told me if it's worth doing, and then also how I can take these results and translate them into language that's digestible and actionable, and who to have the conversation with. So it allows me to understand what's happening on a decision level within our government, both for Providence and Rhode Island at large, and what's missing, where the gaps are, and what we need to do to kind of get to the next step, right? So I don't know what agency is talking to another agency within the government. I don't know if they're considering heat amongst the other priorities that they have. And if they are considering heat, what are they considering doing? And so the conversations I have with Pima allow me to get a little bit of an insight into that inner working, and then use this research as an excuse to go talk to the right people and try to get a bug in their ear. And that then informs what I need to kind of get to the next step. So on an intervention level, when we think about what do we do on a public health side, or even on an emergency medicine side, what we have for heat is not rocket science, right? And it's also not often hugely impactful. So we open cooling centers, right, that are open during the day, during the week, in public spaces. Sometimes, if we can, which is not always, we open public pools. That's it, right? We don't have other interventions right now. We're not thinking about this on a systemic level. We're not putting misters in parks in the correct parks and urban heat islands. We're putting it on the east side, right? So there's not a coordinated effort on our government's, on behalf of our government right now that I have seen or heard about combating extreme heat. And so having those conversations with people that understand this inner workings allows us to kind of inform who we're going to talk to, what next steps we're going to take, and potentially what we could do about it.
Awesome. Thanks. Corey, I wanted to ask you a little bit about your research team. I mean, the research that you shared was done by a pretty big interdisciplinary team. You, as part of the team, had biostatisticians, environmental engineers, data scientists, and then a computer scientist as well. How did you bring together such a big team from so many different disciplines? I feel like that's a challenge.
Can I just say luck? I don't know. It's a good question. I think the way it worked, there was a lot of luck, right, as there often is, right? But I think with a lot of these problems, as we've been hearing about, they sort of require expertise from a lot of different disciplines if you want to check, hit all the marks and do something that actually has the potential for impact. And I think that if people coming from their respective disciplines are seriously motivated by having that potential for, in this case, public health impact to be part of their work, then you can get people on the same page. And that was sort of the key for this, to get, an environmental engineer who was mostly interested in modeling sulfate in the atmosphere. I sort of met him because he was interested in power plants because they're the source of a lot of that sulfate. He knew a lot about power plants and emissions and atmospheric chemistry and things that I didn't really know. But he sort of appreciated the potential for downstream regulatory public health benefits for that. And so we kind of got on the same page about that. So that was a big part of it. The more biostatistics and epidemiology, I mean, I was in a school of public health. That stuff is just in the air. So there's people around talking about those things all the time. And then somewhere along the line, we got this computer scientist who was really interested in sort of community-focused data visualization, and was just fantastic to kind of get her interested in this type of work. And it all, floated the work higher, right? And so we had good science, we had good data visualization tools that were very public-facing, which helped get the word out there. And it was like a little bit of a, catching lightning in a bottle set of luck, and being in the right place where everybody's motivated by, kind of thinking a little bit beyond their own technical discipline, and prioritizing some sort of potential for public health impact.
Awesome. Thanks. So we're going to move on now to the second round of questions, which are really focused on what brought you into the field of climate change. So Emily, I'm going to start with you. A lot of your research has been focused on older adults. And previously, a lot of your research wasn't in climate change, but now you've kind of pivoted to this new world of climate change. What kind of encouraged you to shift into that new field?
Yeah, thank you so much. So as I mentioned a little bit ago, I am a gerontologist and health services researcher. Most of my research before this project was in the long-term care kind of space, looking at how interorganizational policies and practices influenced outcomes and experiences for older adults. And most of that research involved interviewing healthcare providers, healthcare payers, and healthcare users to understand about those experiences. And while the projects that I'd previously focused on were on, usually on healthcare policies and practices, and never previously explicitly on climate change. Climate change was something that continued to come up across projects over the years. In a project with Meals on Wheels, where I was studying a socialization program that Meals on Wheels programs around the country were trying to offer, it kept coming up, the challenges of, delivering to their clients during blizzards, or concerns about the volunteer drivers who are often older adults themselves, and like the temperatures that they would have to be driving around in, and like, do they have enough water? And I remember hearing from drivers about like, okay, I make sure, my route takes me 4 hours and I don't know where I'm going to go to the bathroom, so I don't drink any water the whole route. And, I remember sort of communicating those concerns back to the Meals on Wheels programs. I also heard about like, Meals on Wheels programs saving people during a blizzard because they're the only person that an older adult, would see that day. There was another project that involved interviews with nursing home administrators, and we talked about, it wasn't supposed to be anything about climate change, but we talked about what happens when there is an extreme weather event, what happens when there's a hurricane, and how are people evacuated. I'm sure it's not news to many of you that, many of the deaths during extreme weather events, during and after extreme weather events, are among older adults. And so it continued to come up. And then this opportunity for this P20 grant came to be. I think I was the last person to join the team. They needed someone who it had been decided that this grant would be focused on aging because of all the reasons that I said, that older adults are more vulnerable. And I was lucky enough, Corey said, lightning in a bottle. I was lucky enough to be invited to join what was already a really exciting team. And now I'm really pretty thoroughly committed to climate change and thinking through additional grants with Allan about how to sort of marry issues around policy and practice with climate change and health for older adults.
Great. Thanks for talking a bit about what brought you into the realm of climate change. Allan, moving on to you. Did you always know that you wanted to do something related to climate change, or was it something that changed as you were going through all of your academic studies?
So it's definitely something that has changed over the years. It's now been a few years since the pivot into it, but particularly I was drawn to the use of satellite remote sensing to help inform better exposure estimates, because I felt like the epidemiology for air pollution and heat could be improved. And I really like the idea, I mean, this almost speaks to the value of great visuals that Corey said, you know, when you see long-range transport of wildfire smoke and you see those satellite images, or the ways in which we track, you know, tropical cyclones from space and we can see them, you know, they're so big. I think that the allure for me, we have a culture, have historically made government funded satellite data public, and there's a strong open science community there. And so the sort of accountability of it was very appealing. Some of my environmental modeling really started in Mexico, where there were fewer ground stations. And I really felt that the augmentation that comes from satellite data would really play more of a role. And then I realized, you know, we do have a lot of data in the US, ground data, more than in most parts of the world, but there's still a lot of gaps. And so I would say that the shift to do things that were more air pollution related was because I saw an opportunity to improve the science that I was seeing. And then I jumped to heat when I realized that some of the same ideas that I had been thinking about in air pollution would apply there. So that was sort of a complementary field. And then now I think that we should, as a society, be thinking about heat and air pollution at the same time, because they often go together. And a lot of our regulatory actions or warning systems are really just set up to think about one kind of climate hazard, but we're gonna see more compounding events.
Awesome. Thanks, Allan. Kate, I've known Kate for a long time, so I get to ask Kate a little bit harder questions. Kate, I know you started your career in global emergency medicine and you were working on global health. And, you know, over the course of the last 3 to 5 years, you've really transitioned more into climate change and health. Like, what made you want to transition from global EM to climate change and health? I mean, like, both of them are great fields to be in right now with lots of funding. Sorry, everyone, that's a joke. Because global EM, I think, has less funding than anything right now. But what kind of made you want to transition to climate change and health from something that you did a fellowship in? You did your fellowship in global emergency medicine.
So I think that I snuck into the fellowship of global health. Don't tell Adam Levine this. To be
Nobody
able
tell Adam Levine.
to learn research, to be able to look at climate change. So I always thought that climate change was the biggest threat of our time. And when I was a resident, I wanted to give my senior lecture on the future impacts to emergency medicine from climate change. And I was told, this is not to date myself, but this was over a decade ago now, that was not a thing, right? They couldn't understand that this existed or that it was relevant to me. And I was told, not your lane. And so I gave a very boring lecture on the management of migraines. But didn't have any examples of emergency physicians researching or interacting within the climate change sphere until my last year of fellowship, when I went to a conference and met Dennison Martin, who does work around sustainability and climate change and has a background in environmental engineering. And that was the first time I had come across an emergency physician working in climate change, and almost the next week pivoted 100%, and was told by a mentor that I was coming out of the climate closet. But I felt like I legitimately felt like the work I was doing in global health, one, that the value I was adding did not offset my emissions flying there. And also that that climate change was affecting them more than anything I was researching. And so really until I felt like I was helping to clean up our own backyard, I felt like that was more valuable space for me. And then we kind of formed our own little cohort within emergency medicine, Kyle, you being one of them, of us trying to figure this out, like trying how are we in Brown Emergency Medicine going to do this without really any good examples around us. And I didn't feel like I started to get a foothold or figure out what I was going to do until I started terrorizing DEEPs. And I found the climate scientists at DEEPs and bugged them relentlessly, and now feel like we're kind of really starting to find our footing.
I'm going to ask you a follow-up to that, Kate. Why do you think that emergency medicine physicians were like the first specialists here at Brown to get really interested in climate change?
I think because we see it, right? Like we witness it. We witness the young man dying from heat stroke at the marathon, right? I took care of 2 homeless individuals that froze to death on a park bench after plummeting temperatures 2 winters ago. We see it. And once you see it, you really feel like you can't look away.
Thanks, Kate. Corey, I just wanted to follow up and ask you, what kind of brought you, biostatistics to the realm of climate change and using biostatistics to analyze questions related to climate and health?
I know it's pretty obscure, right? Yeah. Well, the story's not that different from what was described in the panel this morning. You're studying math and statistics and you're doing stuff, and then you sort of start to see the potential relevance of some of the work. And for me, that was policy relevance, again, starting with air pollution. I was working on some things that turned out to be kind of important for how the federal government sets air pollution regulations. And that's how I kind of got my foot in the door. And then, but I think for more, like for the other kind of data science oriented people in here, like when I first got into this work of sort of, let's just say, environmental health, what you see as a data scientist, someone who's really interested in the data and the methods and the uncertainty and how to put these pieces together, you see sort of, well, the epidemiologists are kind of doing their thing, and then the measurement people are kind of doing their thing, and then the more like atmospheric engineers are kind of doing their thing. And they're not doing these things completely in parallel to each other, but they're not really integrated that well. And if you're interested in, again, details around the data and how to make sense of data, you can see opportunities to kind of glue these things together and draw new insights. And I think that's what's kept me involved in environmental science and climate science is, there's new measurement technologies, there's new modeling technologies, there's new data sources, and there's new health questions that are coming up. And I do think that there's a place for statistics and machine learning and I guess I'll say AI too, to try and help glue these things together and make sense and learn new things that cut across these disciplines, right? We all know it has to be an interdisciplinary approach to address these types of sort of big global crises. And for me, I see a path to do that through data and through methods to analyze data.
Awesome. Thanks. Now we'll move on to our third round of questions. Emily, I just wanted you to speak about how scholars and researchers here on campus might be able to connect with community partners. How can you go through the process of like identifying a group to work with and then reaching out to that group, which might be pretty scary for some people who might be more introverted. How do you make those sorts of connections and establish those sorts of relationships with community organizations over time?
Yeah, that's a fabulous question, and I think it's maybe a smidge different in Rhode Island, where everyone is already really pretty well linked. There are a lot of like existing connections, and I think for that reason, my primary advice would be like try your best to understand the lay of the land before making any outreach. I would say rely on existing resources like the Swearer Center, like Advanced CTR. We have a person in the School of Public Health, Sarah Bouchard, who is like the community engagement person. Because as was said in the first panel today, a lot of these partners are getting a lot of outreach from well-intentioned researchers who want to connect with them. And so to the extent that efforts to do that outreach are united and not duplicative, I think that goes a long way. I would also say be aware of like the history of sort of the contextual information and the historical information of the way that researchers have engaged with these types of communities and the ways that Brown specifically has engaged with communities in the past, because you're not like even if it's your first time making an outreach attempt to someone, it's very likely not the first time they've had someone try to connect with them. And so I think trying to learn as much up front before making that outreach, and then relying on existing connections, relying on other researchers who have already made connections, and building trust on the trust that they've already established, I think are critical first steps.
Awesome. That's really great advice, and I appreciate you giving it. And I think it helps to understand some of the historical relationships that have been there and to take advantage of some of the established connections that we have instead of trying to go out and independently establish your own sorts of connections. Allan, I wanted to talk a little bit, or I was hoping you could talk a little bit more about why community engagement is important for the research that you're doing, particularly with heat and aging populations.
Yeah, so I think that, when I arrived at Brown 2.5 years ago, one of the goals was to build more of these connections. And I really appreciated that, Emily has spoken about this trajectory through long-term care as a lens, and the partnerships that already exist, that climate was sort of coming in there. And so I think that I'm still sort of learning about these connections as someone who's pretty recently arrived. And I think that we heard this morning that the ability to have any kind of impact, right, is really dependent on answering relevant questions and finding the levers of change. And that could be whether you're figuring out, who is making operational decisions, or, how is information disseminated through communities where the information that needs to be disseminated has to be responsive to the questions that those communities bring up. So I think in the space of climate and aging, part of it is just understanding the ways in which older populations and the community groups that we're interfacing with are even thinking about climate, which is often not using the word climate at all, right? It's about, the decision making on a hot day. It's about, checking whether someone's air conditioner works. And so I think that we'll have better, more interesting science and much more relevant science if it can be informed by the kinds of ways in which we see that these groups are already engaging with the topics that we're calling climate, but are just part of their portfolio, right? It's just one slice of the things that they're doing. So I'm really hopeful that by better understanding how community groups or government agencies are encountering these things that we're calling climate under this academic label, we can come up with better science that's, addresses their needs.
Awesome. Thanks. Kate, you mentioned your collaboration with Deeps and just kind of going in and annoying people. My next question has to do with like cross-campus collaboration. So we here at Brown have multiple different campuses. Some of you might know that better than others, but we have the undergraduate campus, the public health campus, and then we have the medical school campus. And I wonder, having been someone who's managed to work across the different campuses, like what sort of strategies can researchers use who might be, interested in making those interdisciplinary connections across the different campuses. How can we go about making those connections across the different, so to speak, silos that we have in the university structure?
So I almost feel like you would be better off answering this question than I would. I feel like there have been several initiatives recently across Brown to try to do this. So there's Equitable Climate Futures, Planetary Health through the medical school, there's Chair C, right, the School of Public Health. And I think going to these events and talking to people you don't interact with every day is very, very important. And then I do think that, at least it's worked for me, it's emailing people your questions in a humble way. So I don't know climate models I'm learning, right? But I know the health piece, but the projection piece or the climate piece and the downscaling of climate models, this is all a new world for me and new language. And being able to have those conversations, to meet with somebody and talk about what you want, what they want, where it intersects, I think is huge. I think also finding students that bridge the gap, that have interest in both, that bring you together as busy faculty has been hugely helpful. And you can find these students that now speak both languages, and kind of form this bond and ways to interpret between, which I think has been hugely helpful.
Thanks, Kate. Yeah, I agree. I think, across the various campuses, we all have similar sort of goals and ideas. It's just a matter of getting us in the same space to talk about some of those goals and ideas. And I think, as a clinician, my brain works differently than Allan's brain does. I'm thinking of, the patients I'm seeing in the ED, and Allan's probably thinking of something much more intelligent and complicated. But when we come together, we can come up with a cool research idea and a cool research plan. And I think I've sent so many of my medical students to Allan. He's probably regretting that he ever made any sort of offers. But it's super interesting. These medical students come up with great ideas, and Allan's able to connect with them and really come up with fabulous research projects.
And I think the other piece, Kyle, is it's different scales that we're working in, and different scales, different geography, and different time frames, right? And so having to work through the different time frames that, like, what's the future for a climate scientist and what's the future for a physician, right? Those are two vastly different things, right? For me as a physician, the future is next year, right? And for climate scientists, they're like, don't talk to me about the future unless it's 50 years from now, right? So I think those are also kind of interesting conversation pieces.
Corey, having worked with interdisciplinary teams, do you have any pro tips as to how to keep everyone on task and everyone working on the manuscripts that they're working on and getting research done?
No. That's a good question. I don't know if I don't know that I have. I don't know if I have a great answer to that, other than sort of just alluding to what I said before. I mean, if you can have your sort of, guiding North Star be doing something that is maximizing the potential for a goal. In my case, the goal was some sort of public health impact. It's I had other biostatistics colleagues being like, oh, that biostatistics, that's sort of what you're doing there is sort of simple. We've done that before. And I had to be like, well, I understand that, but I think it's important. So I think we should keep doing it. And then my engineering colleague, I'm sure he had people in his, civil and environmental engineering department who were sort of like, well, this is a little simplistic. You need to do something more novel. And he had to kind of say, well, yeah, I understand that, but I think this is really contributing to this bigger goal. And I think if you can keep people on that task, then you can keep the right incentive alignment for them to keep going on it, even if the more obvious disciplinary incentives for them might be a little bit different. Don't ignore what your department chair says. Don't completely forget about your disciplinary, priorities. That's not what I mean. But I do think that sometimes you have to, people get, especially with journal publications and things, you get hung up on novelty. You got to convince a panel of other engineers that what you're doing is really novel, or you got to convince a panel of other statisticians that what you're doing is really novel. And I think you have to have some, again, like guiding North Star to break you from that sometimes if you want to have a different objective, which is do something that may be simplistic to some, but in combination with these other things, really important for some endpoint goal.
Awesome. Thanks so much. All right, we have time now for audience questions. So if anyone in the audience has a question, we will bring the microphone to you.
Hi, thanks so much for these insights. I had a question following up on something that Kate was talking about around students. We have a lot of early career scientists and students in the audience. So, we're an educational institution, training institution. So if you could imagine a strategy to train or engage or school up, skill up the next generation of scientists so they don't maybe take such a wayward path as many of you have articulated, like what would that look like here at Brown?
I think one thing that would be amazing, and I don't know if it's being done anywhere, to be quite honest, but we have a lot of joint MD, PhD programs that are formed. But I don't know of any joint MD, PhD programs with climate science being the PhD. So some sort of combination there, I think, would be really fascinating. That's one idea.
Another idea that's been happening in a very small scale for our Chair C grant is we've been connected with, so we've been able to start to link faculty who have projects that are relevant to the grant. So for example, we have one faculty member in public health who teaches a community engagement course, and to teach that course effectively, she wants to connect students with relevant community partners. And so we've been able to connect with partners that are interested to be able to embed students there. We've also been able to connect an anthropology professor who wants to teach a course on aging with some of these organizations. So I think the extent to which we can foster as early as possible interest and connection within students who might want to be researchers, but with, the ability to foster connection to directly the populations that they might be interested in either doing research with or treating if they, go the MD route.
And I'll just add that I think that a useful substrate is to think of projects as a kind of unit that brings people together. Often students show up because they have an idea for a project or they want a project. And then that is a great excuse to say, and this project would be better if you also had the expertise of someone who knows something about this other, complementary piece. And so then I think people often in our university come together and span these campus boundaries when there's a project, and that project is often more tangible also when there's data. So I think not all projects are data related, but I think that is sort of if you're a student, if you can think about projects that have sort of that there is some potential for data, or you can create conversations around that, and then that allows that's a substrate to invite different people to collaborate. But it's usually when you have some sort of tangible thing that you want to accomplish that can become a North Star to say, we think that this project would be useful because it arises from a question that we've heard in the community, or because we think it would have a particular relevance, or because it's an open area that requires further scholarship.
Bryce, I see you in the back.
Thank you so much for this. It was really helpful to get your perspectives and understand how you're approaching this from a scientific and collaborative perspective. One of the things that I find challenging, and I think this is a particularly ubiquitous issue within healthcare training, but I don't think this is exclusive to healthcare training, is the lack of education and support for high risk, high reward science. And I think a lot of what we have, from a structural perspective, run into is there's a emphasis on quantification of how much you actually, what your output is. And in healthcare training, we really do prioritize, in a lot of aspects, incremental science. And one of the challenges we run into is we have this level of expertise, and this is this entire concept of like how we are siloed in different healthcare disciplines, and how we don't necessarily think about these things from a holistic perspective, yet everything from a systems perspective in humans is connected. And this is broadly applicable to everything else, how we integrate and interact in these networks. Obviously, the complexity is really challenging, and understand how to actually think about how, from a food systems perspective, as a place where I live in, how does like sourcing food and the actual soil quality and the nutrition of the food, how does that actually impact health? And how does the processing of food actually impact health? We always like break down. We start having these multidisciplinary conversations of these interactions. But one of the things that I try to facilitate, and I don't know the best approach, is how do we actually train our trainees? And this is, again, amongst all specialties. How do we actually train them to try to foster these bigger questions? How do we actually go through this topic of providing them the emphasis of, well, you need to learn what the process is. You need to go through this formative experience, and you need to have something that you anchor to that you find meaningful and purposeful, because that's what's going to provide you with the most success, without dissuading people from thinking about these things that are more broadly applicable. So like, Kate, for your example of when you were thinking about what your presentation was and you went to migraines, I had a similar experience when I was a trainee, about how I was talking about food systems in the context of health. And I was told that if I continued on this way, I would never be hireable. It's kind of this dichotomy where it's like, we really need to take risks, because if we don't, the risks of climate change is going to have profound implications on our health. But we are in a structure where we don't support risk. Very long-winded question, kind of tangential, but I just am curious what your perspectives are about how you foster these conversations with your trainees, because you really need to have these conversations earlier on in your career, rather than getting into this kind of monotony of just having output that doesn't really make meaningful changes into the field that we're working within.
I mean, the only thing I would have to say to that is what you said right at the end is you just got to start earlier. So like when somebody in training, I mean, so I think this is a role that like, IBIS plays here. And Frank was mentioning how many of the undergrads at Brown are taking environmental science courses, let's say, and maybe they'll go to medical school, maybe they'll go get PhDs in computer science or whatever. But if the earlier you start, the less likely it is that they're going to have to be starting from scratch when they decide they're interested in global health or something like that. Because I mean, that's an easy answer to say, that's an hard answer to do. But I think the more people are trained earlier to be thinking more broadly across disciplines about a topic area like climate change, the better off they'll be when they're starting their residency and they have to, pursue something quickly, or they're starting their postdoc in statistics. They can't be like, well, I think I'm interested in climate change. Maybe I should like try and do that and be out of here in 2 years with a job. Like that's not how it's going to work. So I think that sort of even undergraduate level educational programs, it's sort of a long game strategy, but you can imagine that changing the calculation down the line.
Bryce, I don't know if I'm allowed to answer the question. I would say that like some of it has to do with the specialty training structure and the way that specialties choose the residents that come into their program. So I think you need to have residency programs that are more open to people who are interested in high-risk fields. So for example, like if Brown's gastroenterology residency program is more open to people who are willing to take risks and do research on food systems and how it affects their patients, or if an emergency medicine program is more willing to take someone who's doing research on climate change and health, I think that makes a big difference. A lot. I know there are several medical students in the audience. I think there's a big push, especially if you're going into certain specialties like neurosurgery or orthopedics, that you just publish as many papers as possible. And it's not necessarily the most effective high impact research. And I think perhaps if we can shift from that publish as many papers as possible sort of ethos to a more publish one very effective paper ethos, then maybe that can potentially change the way that we as clinician researchers shape our entire environment and then work collaboratively across campuses and across institutions. I don't know, sorry I answered that one.
Hi, I just wanted to say Nadine and I both majored in environmental science here and now are working on our medical degrees also here. So it's working on some of us. But I was wondering to everyone on the panel, when do you choose to incorporate qualitative research and interviewing people who are kind of part of the data that you're collecting to inform your research questions? So when you're working in nursing homes and seeing how hot days are impacting residents there, at what point do you go and see what those HVAC systems actually look like?
Yeah, thank you so much. I'm happy to start with that one. So I would argue that there's almost always a place for a qualitative aim. Like many of the R01 research grants that I'm a part of, there are 2 quant aims and 1 qual aim. And I think it's really exciting because while the quant can tell us, how many, and it can tell us maybe what's going on, it doesn't really tell us much of the why or the how. And so by asking, the people that, live in a nursing home or work in a nursing home, like why things are the way they are or how it feels to be there, we're able to get insights that you wouldn't be able to get any other way. I'm thinking about work that Allan and I have been discussing and that Allan's been working on, where he's like sort of looking at existing data around like what are, and there's a great poster that Sarah has, like what are air conditioning, what are HVAC systems like in nursing homes, but then you're limited to the tax data that Allan is using, which doesn't have all the information, and you can't really get all the information unless you go there and unless you like find the right person to ask and the right way to look at it. I'm also thinking about, in intervention work, it's really, I think, important there to have a qualitative aim because, all right, you invest all of these resources into trying out an intervention and, you have this like really rigorous quantitative way to see if it worked. And then, oh no, it didn't work. If you don't have a qualitative aim where you're like, investigating how it was carried out throughout, you won't have any insight into the how or the why it didn't work, and you won't have as clear an idea for next steps. So I would just say always.
Thank you, guys. This is more like community because me and Maria Jose represents the community. How can you engage in vulnerable and hard-to-reach communities to ensure they receive information and resources about emergency preparedness and climate change?
That is a really fabulous question. One that we've been starting to look at in the grant that I'm a part of. We've had some great students helping to catalog what's already being done specifically in Rhode Island, what resources already exist. We've been having lots of conversations with government agencies that are responsible for producing these materials and hearing from them what they think goes well about the materials they produce and the way they produce them and what they think can be improved. We also need to do more to connect directly with the people who the materials are intended to reach. And that's something that we're working on as part of this grant, at least as it relates to older adult emergency preparedness. We have one specific project we're engaging with Providence Housing Authority right now to look at their emergency preparedness planning. And so we're planning to go in and talk to the residents of a particular housing development to hear what their needs are and how they access information and we're working to co-develop, and I would recommend whenever possible co-developing resources and materials with the people that they're intended to reach to make sure that they're actually useful to people and able to reach them. So that's a wonderful question. And I would really welcome any suggestions and ideas you'd have.
Thank you. Yeah, thank you all for everything you shared. So I'm a climate scientist doing some work that's relevant to health and interested in work relevant to health. And I was wondering, and maybe this builds off some of the questions that you've already answered, like how do you see work with climate scientists advancing your disciplines? So thinking about what Corey was saying, like the need to make a disciplinary contribution, like what do you see as most exciting in this realm, like in your research areas?
So from a health standpoint, I feel somewhat confident in being able to quantify health impacts with temperature data or climate data that's happening now. But I definitely lack the confidence to project that forward with climate models. So I always find that hugely helpful. The other thing that I think would be extraordinarily helpful and potentially impactful is to work with climate scientists around attribution. So to use those climate models to create counterfactuals of what it would have been like had there not been climate change, human-induced climate change, and then quantify that health impact difference. And that also would allow us, so it allows us to say, this is how you're being hurt now because we're burning fossil fuels. And it would also allow us to bring in the economic piece to quantify the economic burden from these health impacts. When you look at economic studies around disasters and climate change specifically, now it's all around infrastructure, and there's almost zero economic impact from the health side of it. And a lot of times what's tricky is that there's these baseline disease prevalence that we can't separate out. And I think that you all would be able to help do that. So if you're interested, let me know.
I can add, I would have said those same things actually, and which is good to hear. But the one thing I'll just add to that, in part because it came up this morning, is issues of resolution, like sort of like the pictures Chris put up on the slide. I think that comes up in analyses of health data all the time, right? So a global climate model is not going to produce a study, climate exposure estimates or projections that's going to allow us to investigate asthma emergency department visits and future extreme heat events. When we measure those asthma emergency department visits at sort of the level of like a census tract in North America. And so there's a real resolution mismatch, I think, between the types of climate exposures that are often produced by mathematical models, basically, and where the health data actually are. And so I think there's a lot of good work ongoing and that could continue to be done.
Thank you. Well, this is a great event, and I really appreciate this discussion about how to create these transdisciplinary connections at Brown. There's been some mention of creating more connections between different institutions in Rhode Island. So I'd be curious to hear about any experience you all have with that, working with researchers from other educational and higher ed institutions in the state, and any ideas you might have for how we could make that easier.
I'm going to take that a little because I'm not sure if people on the panel have actually done that, but this morning, and Manu DiLorenzo spoke about the 3CRS program. And that is a collaboration between Brown University, University of Rhode Island, Providence College, as well as universities in Maine and New Hampshire. And I think that to really do that kind of work well it's very challenging because of the institutional boundaries. And so it takes like a lot of resources, like having an EPSCoR grant from NSF to do that kind of, to motivate you to propose to even try to do that. So it's not really an answer to how to do it, except that to say, in order to do it, you need to have that level of resource to make it happen, to make the connections work. But there's obviously a payoff for doing it, because there are things that University of Rhode Island does really well that Brown doesn't do, and vice versa. And so those are incentives, but you have to start having those conversations across universities before you can even realize those possibilities.
Yeah, I think this is a really important question as we mature the work across the state, as we think about the partnerships that are in the room today and may expand going forward. It's deepening, it's growing. We hope that is the case. And we bump up against each other, and we have real risks for community partners, for policymakers, and for impact, and how this is all relatively uncoordinated right now. And so one of the things that we did propose back when there were large calls for climate resilience in the federal government was a academic climate collaborative, which would involve every major institution of higher education in Rhode Island and permanent staffing to kind of help coordinate, consolidate. They were going to be mapped to the health equity zones, kind of geographically, to really think about how this is coordinating and funneling up and out in a more coordinated way. So I'm really sad that wasn't funded, obviously, back in the day, and now the call is erased. But I do think it's that kind of idea that we might want to think about when we think about, foundation funding or any of the other work that's going forward in this room, to remember that that is a relatively cost-effective way to gain, exponential impact for all the work that's going on here.
I think we have time for one more question.
Is that me?
Oh, we can do two more questions.
Thank you. Sorry. Thank you all for the discussion so far. This is kind of going off of the climate science and collaboration question, where, if you're kind of collaborating with climate scientists and doing research on like human health outcomes, I can kind of imagine a lot of the nature of that research is correlative, which is of course very important and indicative, but maybe has some limitations compared to like causational studies, and maybe like which are very difficult in the context of like a complex human health impact. I'm wondering about the limitations of maybe that kind of like correlative versus causative and complex medical, right, like rooted information, the limitations that kind of frames your research, as well as like prescriptive policy suggestions and things like that. Thank you.
Great question. How much time you got? I can speak to that a little bit in terms of at least like large scale epi studies, like population health level studies. And so, which maybe this is what you're alluding to, in statistics, epidemiology, there's huge areas of those disciplines that are about causal inference. That connotes a set of methodologies that they're not any type of silver bullet. They don't like automatically prove causation, but it's a set of methodologies designed to clarify kind of the biggest threats to any sort of causal validity of a study that is ultimately about learning about relationships in data. That's a huge area of statistics and epidemiological research and other areas, computer science and things. And there's a lot of that going on in this space, actually. Certainly in air pollution, this is an area that I focus in actually. and increasingly also in, extreme heat or other kind of health outcome studies of environmental exposures. But, you're not randomizing anybody to high heat, right? So this is all to say that, the trend towards those types of analysis methodologies in environmental health is similar to other areas of social science, clinical medicine. There's a lot of action.
Hi, everyone. I'm Betsy Laux. I work in the Research Strategy and Development Office in the Division of Research, and I'm going to ask a question that's going to sound more provocative than it is, which is, how important is it that we use this word climate change when we're talking about this work? I was thinking, Emily, about when you're working with seniors, that generation of folks didn't know that term when they were younger. And so how important is it for you to say, hey, this experience that you're having is because of climate change? Like, how much do you need them to buy into that? And so in this current federal funding environment where we can't use that word, what are the treasures you want to bury right now with your research program? So that's really the question for you all, is like, how can we bury some treasures right now given the current environment? And what are those, so that when we come up for air, we're going to be able to go back and say, hey, we figured these things out that's going to allow us to really take some leaps forward.
Yeah, I think that's a really tough question, and one we've been grappling with, even as we think about the name of our Chair's C grant, which previously had climate change in the title and now does not. In the work that I do on the community engagement core of that, we've been asking older adults explicitly, how do you think about the phrase climate change? What does that mean to you? At least in the conversations we've been having, there hasn't really been pushback about climate change. People are acknowledging that it's happening. We aren't trying to argue with them about what are the causes of it, and it's sort of not relevant to the point of the work that it all depends on what is the question that the research is trying to ask. And as it relates to this work that I'm doing, we just need to know what are their climate change related health concerns and priorities, and it doesn't matter exactly if they're calling it climate change or if we're calling it climate change. I think how that then plays into this cycle of, well, it's important to call it what it is because, we need to continue to fight for, accuracy of, and legitimacy of, sort of a bigger problem than this small question that I'm able to focus on right now.
Yeah, so I'll just share from a perspective of someone who's funded by the National Institutes on Health. They have a health and extreme weather strategic plan that came out pretty recently that recognizes that extreme weather, including anthropogenic air pollution and heat and some of the phenomena we've talked about, really is quite impactful for human health and is a priority of the National Institutes of Health. So that piece is still very much within their portfolio. I don't personally want to decouple that, right? And so I'm sort of thinking about, can we have kind of modular research programs where pieces of it are being supported through existing channels where those fall in alignment with those priorities, and then how do we keep those other components going? Because I also am very interested in, how can we marry our societal investments in mitigation to improve health adaptation, which is often quite local, or, what do the climate projections say will happen when we can downscale them to a scale that is relevant for human health. So those, I'm really thinking about not so much burying. I hope we don't have to bury anything, but I'm thinking about modularizing the work so that components of it use sort of preferred terms, and that other components continue to move forward. And we sort of say, oh, no, that wasn't part of that study. That was this other thing.
I mean, I think that I am probably pursuing similar strategies to has been described. I mean, you submit a grant that's about causal inference with spatial environmental data. And like I might be anticipating a bunch of statistical methods development that will be used for evaluating health impacts of climate change, but it's not what the grant is about, right? Grant is about spatially indexed data and causal inference. And so maybe for like that type of kind of very in the weeds methods development, it's a little bit easier to frame things as more generally potentially applicable than about a particular topic, but we'll see if it works.
Awesome. Well, thanks everybody. Those were some really fantastic questions. And I wanted to thank everyone who was a part of the panel and give everyone in the audience a chance to give you a round of applause.